Is one matrix system good for all class 2s? Let's go to photo number 1. Photo number 1, I'm sharing with you a case where I'm using the Compositite 3D system by Garrison. I like it personally. I use it a lot in my practice. I know it's an old system. I get it all the time from Garrison. Oh, this system has been out there for 10 years or more. Who cares? It works. You don't need to have a new one if you're using this system in your office. Let's go to photo number 2, the saddle matrix. Love it. These are Russian matrices. The saddle matrix, I buy them on eBay. Very good for multiple cases like the one that I'm sharing with you right here. This is the last tooth, the abutment tooth, the one that you're using to hold your clamp. There's not a lot of room. There's no distal molar, so you can't place a ring. What do you do then? These saddle matrices are excellent for cases like the one that you're seeing right here. Let's go to photo number 3. Make your own matrix. Let's look at that. You can see that mesiolingual cusp is fractured. I got to get rid of it. But before I get rid of it, let me make an impression using Regisil. And once I make the impression, if you go to photo number 4, I've now removed the cusp. And all I need to do, if you go to photo number 5, is rebuild that cusp using that matrix, just like the same way that you will use a matrix for a class 4 on an anterior tooth. And what do you accomplish with that? If you go to photo number 6, after building that mesiolingual wall, now I place my Compositite matrix and my Compositite ring and build my proximal wall. What other system would I like using? Well, let's go to photo number 7. You are seeing 2 back-to-back class 2, small class 2s on these premolars. What system do I recommend for that today? I would recommend the quad system by Garrison. Love it. These beautiful wedges open towards the lingual. You place, that's photo number 8. You can see the wedge going in between both of the bands. I like using the Compositite 3D bands for this. For the premolars, I insert the wedge from buccal to lingual. They open towards the lingual. And photo number 9, and you place the ring. Make sure that that arrow that you see on the ring is always towards the lingual. That arrow is meant to open that split wedge, buccal and lingual, so that you have a very nice contour of the band towards the lingual surface of the tooth. And if you look at photo number 10, look at the buildups. Look at those proximal walls. Beautiful proximal walls, beautiful anatomy, ideal anatomy. But let me tell you something. If you go to photo number 11, I'm not going to eliminate yet the old classic Toffelmeyer band. There's still a need for it. There's still room for it in our clinical practice. And you're seeing me using it right there for that proximal box, that distal proximal box on that first premolar. And if you go to photo number 12, you can see that the outcome is still excellent. So again, you can make it in your practice with one band. It all depends on the clinical case. See you on the next video.